Hello again. Welcome to round 2. Today we'll be doing a cardiothoracic assessment. My lovely assistant Nicole. First thing you're going to want to do before any assessment is make sure you're providing privacy for your patient. Do good hand hygiene and make sure you have all the equipment necessary for this. All we're going to need is our trusty stethoscope and our patient, of course. First thing that I like to do when doing any assessment is just look at your patient. You can tell a lot just from looking at your patient. You can see how they're breathing. If they have any kind of shortness of breath, if they're using any accessory muscles to breathe. A lot of times you'll see people taking deep breaths and use their belly to breathe. You can look at all that. Next thing you want to do is look at shoulders. Look at shoulder symmetry, make sure one side's not bigger than the other, and they can breathe in. She's got good expansion going up. Look at the back side, spinous process, make sure everything's in a line. Now, typically on a good cardiothoracic assessment, you would want skin to skin. That's the best for. But for these purposes, we're gonna keep clothing on. Next thing you want to do, we'll go ahead and start with the back. You want to feel around and feel it and see if you have any knots or any masses. Also, while you're doing this, ask your patient if she's feeling any tenderness anywhere you go, and if you do, say something. No tenderness anywhere?
No tenderness.
Good. While I'm right here, you can go ahead and check for symmetrical expansion. So what you want to do is kind of put your hands in a wing position and kind of get your thumbs close together. Have her take a deep breath. And what you're looking for is you want your hands to move out and back down symmetrically. And that way that they've got good symmetrical expansion. Next is what you want to do is resonance. You're going to use the same landmarks you would as if you're listening with your stethoscope, only you're actually going to be percussing and making sure that the sounds are all the same. So you start here and you just want to tap. And you want to go to each side so you can compare each side. You don't want to just go moving all around. And you also want to stay away from any bony prominences, ribs, and scapula, so you kind of want to work in and work your way out. Everything sounds good. Next we're going to do is we're just going to go ahead and take a listen. Nicole, when I put my stethoscope down, each time you see me go to a different spot, just taking a deep breath for me, okay? Try not to do it too fast. I don't want you to hyperventilate on me. Another thing you can do on their back is called the tactile firmitis test. Basically what you're doing is you're taking the palm of your hand and you're feeling the vibrations in different areas by having them say a phrase like 99 or blue moon. So Nicole, when you feel the palm of my hand, I just want you to say 99 for me, okay?
Okay. 99. 99. 99. 99. 99. 99.
Good. And you're looking for equal vibrations on each side that you do. You don't want anything to differentiate between those two. Another thing you can do with your stethoscope, there's different tests you can do that kind of has the the same basis, only you're listening. They'll say a phrase. There's 3 different ones. A lot of times you'll only need one. But one is like the whisper pectriloquy. And basically you'll have them whisper a phrase, and what you want is you don't want to be able to hear it at all. You should be able to, if you can see your patient, you'll be able to see their lips move, but everything should be inaudible when you're listening to the lung sounds. So Nicole, when I take a listen, I just want you to say 1, 2, 3, but whisper it, okay? Whisper for me. 1, 2, 3. There you go. Perfect. That's a good thing. I didn't hear. I heard it the first time because it was a little bit louder. Okay. That concludes the posterior portion. Next, we would do the front side. You can do the same things as far as your percussion tests with the same landmarks on the front. We won't go through all of them. I don't know if you want me to go percussing on your front side. But you can do the exact same test on the front side, and you're checking for the exact same things. Lung sounds on the front side are a little bit different. We're going to go a little bit higher up top to hear the upper lobes, and we'll go to the sides too, because they have a different sound on the posterior side. All right, deep breath. Might help return. I don't know if you can see where. There we go. My apologies. I placed stethoscope here, 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 and at the sides. I didn't know if they could see me. All right. That concludes our lung assessment, and like I said, you're wanting to do the same thing up front as you would do posteriorly, and you want to assess each side so you can compare each side as you go. Next is what we're going to do is we're going to go move on to the cardiac portion. First thing we can do, it's real easy, assess their carotid pulse. Do them one at a time. Again, don't want to cut off blood flow to the brain. Move on to the listening portion. You can also listen in the carotids. One thing you're wanting to check for is if they have any type of stenosis. You can hear like a brewy sound. It's not a good sound. You don't want that. Next thing I'm going to do is listen to her heart tones. I have a little mnemonic that I use. It's people say all people, but I like to say all physicians take money. And it's second intercostal space. We're listening to the aortic valve. Pulmonic valve, same spot, opposite side. Tricuspid. And then mitral. And here Here's where you really need to listen and you can get their apical pulse. Listen for a full minute. Nope. I usually just listen for 15. Times that. You didn't hear that. Low 60s. Usually run that slow? Yeah, for the most part.
Pressure's really low too.
Some stethoscope have a diaphragm and a bell. The bell's going to allow you to hear different tones. You listen to the same ones, only with the other side.
It's really sensitive. Can you hear the valves?
It's got a different sound to it. And that concludes. I did want to mention a couple of other tests that you can do as far as different noises that they can make while you're listening. There's the bronchophony. I said that awful. Basically, you're doing the same thing, listening in various areas and having them say 99. The goal behind that is you don't want to hear them saying 99. Another one is the egophony, and I think you got a good name because it's egophony and you want them to say E, and listening you shouldn't be able to hear them with that too. That's why, you know, I wouldn't think you would do all three, but you can at least use one or two to assess different things, especially if they come in complaining of pneumonia or congestion, anything like that. That concludes our assessment. Thank you, Nicole.
Thank you.